Ashley Toski. Welcome to Mendocino County's COVID-19 update. Today, as normal, we are joined by our Mendocino County Health Officer, Dr. Andy Coren, who will give an update on the COVID-19 status of our county. After that, we will then open it up to take a few questions from the media. Out of consideration for preserving staff time, we are asking that each media outlet limits it to 2 questions each. If time allows, we will also take questions from the public. If you are a member of the public and you have a question you would like to see addressed, if we have time, please leave that question in a comment below on this video on either YouTube or Facebook. Now, beginning with the health update, Dr. Coren, you have our attention.
Thank you very much and welcome everybody. I want to start first with 2 important announcements. The first one is a cautionary one. There have been a number of overdoses connected with fentanyl and methamphetamine in our county, and they are on the rise. And there actually has been 1 death reported in this past week. So please encourage everyone you can to exercise caution, stay safe. The next announcement is a very proud and happy one. I want to proudly announce that our Deputy Health Officer, Dr. Mimi Doohan, has been appointed as co-chair of the State Health Equity Committee for the California Conference of Health Officers, CCLHO. So that's very good. She's been working on our behalf all this time, a little bit of the time behind the scenes, but she's been a very strong advocate for health equity. So next, moving on to the presentation, I'll start with data. As of March 17th in the United States, the coronavirus cases have numbered 29,585,015 cases with 537,583 deaths. These numbers are increasing, but increasing more slowly than they had, of course, in the last month. In California, our total cases have numbered 3,532,496, and the deaths at this point are 55,577. In Mendocino County, our average daily new cases as of today is 5.01, and that is just a little bit elevated from the last time we talked. Positivity rate is 2.3% at this point. Our cases are slowly decreasing. They now number 3,888, and our R effective value is 0.76. Again, that's a measure of how much this virus is spreading. When it's less than 1, then each person who has the infection is passing it on to less than 1 person. So the overall numbers should be shrinking, which we also see. The total cases, I just mentioned the total cases, I think, yes. So the total cases are 33,888. Among them, Latinos number 1,954, which is 50.3%. And that percent is decreasing, but slowly decreasing. Currently in isolation, we have 39 people, and in quarantine, 63. The deaths now are up to 46. There was a 89-year-old elderly Caucasian male from Fort Bragg who recently passed away. And in the past week, a 57-year-old woman who had multiple comorbidities from which she probably passed away from in Memorial Hospital, but also had COVID as a comorbidity. In the hospital at this point, we have 1 person in med-surg in Ukiah, no one in the ICU, and we do have 1 Mendocino County resident hospitalized out of county. We have no new outbreaks. The Ukiah post-acute outbreak is resolving. That involved 11 residents and 3 staff. This infection was brought in by unvaccinated staff, and we are finding that healthcare workers have been delaying their vaccinations, which is a very dangerous thing, but there's hesitancy among all groups, and we really want to encourage everyone to be vaccinated. Testing now is available at the fairgrounds from Saturday to Thursday, 9 to 5 p.m. and Fort Bragg Veterans Hall on Tuesdays from 9 to 5. The travel team today should be in Laytonville Meadow Gym at 200 Branscombe Road. And Consolidated Tribal Health Project is also having an event at 190 Sherwood Hill Road in Willits. On March 26th in Covelo, they will be at 23925 Howard Street in the Round Valley Library. We've been able to negotiate a more efficient mobile team for Fridays 9 to 5. That probably won't start for another couple of weeks, but it will be rotating through 2 sites per day, making the whole circuit through the county in less than a month. And the plan for now is that and it'll only be on Fridays, it'll be Point Arena and then Anderson Valley Health Clinic, and then Laytonville, and then Willits, and on another Friday, Gualala and Anderson Valley, and the final Friday will be Round Valley and Willits. So Consolidated Tribal Health Project continues and plans to increase their testing events. Though the recent state data shows Mendocino County utilizing our capacity better than others, we still need to do more on this testing. This is our way of picking up asymptomatic cases and protecting our families and our communities. We are working on arranging a program of regular whole genome sequencing for any current variants that may be entering our community. And we are sending it to the Solano lab, which is our county lab. And that is going on actually at this point, though the turnaround time for the Solano County lab takes about a week. It takes significantly more when it's done out of county. CA Notify, which is a smartphone app to notify people of close contact with others, is available online. And of course, we continue to do our contact investigation and contact tracing here in the county. The schools are now testing staff regularly. Our county contact investigation and tracing team is shifting gears with less cases, but just as important as earlier. If fully vaccinated, 2 weeks past the final dose, close contacts now do not need to quarantine. There should be extra caution for people with higher risk, especially those who live with others who are at higher risk, since our vaccine experience is a bit too early to be sure of the duration of immunity and transmission. If a person contacts COVID 2 or more weeks after completing the vaccination, isolation would be continuing, but we will probably send those specimens for whole genome sequencing to be confirmed. Our K-12 schools are opening now, and Ukiah Unified School District has sent me plans for their spring season of sports. And so we're hoping the Wildcats do well, but we also want to review the plans from the other schools and root for them at the same time. We are now, probably everyone knows, in the red tier, and that happened earlier this week. I want to let you know these are the changes. Indoor gatherings of up to 3 households are discouraged, but they're allowed. But be safe, keep them small, and avoid if there's anyone high risk in the household, or if you come from a household where there are other high risk members, you should be very cautious. Continue to wear masks, social distance, and continue the hand hygiene and ventilation. The CDC has released, and CDPH guidance is coming, of when people are entirely vaccinated. We can't go by what the CDC says at this point. They do not have the authority in California that CDPH has, and so we're waiting for the CDPH to interpret things appropriately for our state and county. Additionally, places of worship are open indoors up to 25%. Businesses, groceries are 100% open. Retail, including shopping centers, are are open to a 50% capacity. Restaurants now can serve indoors 25% capacity or 100 people, whichever is fewer. And then if serving food, breweries, wineries, and distilleries and bars, if they're serving food, can be open. They must have seated reservations. Those reservations should only last, people should be seated for 90 minutes or less, and alcohol should stop being served at 8 p.m. If no food is being served, then the bars are closed. Breweries, wineries, and distilleries would be outdoors only with same restrictions. Museums and movies are open to 25% capacity. Now, gyms and fitness centers are open to 10%, and that would include those fitness centers in lodging. But a reminder that no indoor pools are allowed to be open at this time. Live events recommendations have been released, and outdoors with assigned seating with preventing mixing is allowed for sports and performances, and the schools will be using this, at least at this point, as a guide to their commencement activities. Visitation in acute care general hospitals and in skilled nursing facilities is now opening up, but please call first for what that facility allows. There are restrictions if there have been recent outbreaks. At this point, the county, though, fulfills the threshold to allow indoor visitation. And there will be more guidance coming on April 1st for other industries. We're looking forward to all of that. Now moving on to vaccinations. The software is much improved, but this is a dominant feature of this pandemic. So let me go through some of those. The county is piloting the scheduling program, My Turn, and we're using that for county events. In order to use that, go online to myturn.ca.gov or call 833-422-4255. This will be available online and by phone and in Spanish as well as English. It is still young software. We're piloting it and working with developers to improve it. So there are other phone numbers available in the county, and I'll get to that in a minute. Last week, we noted some difficulty for Spanish speakers. They were calling in, and there was also problems with certain categories of eligibility that were not reflected. But again, we're working with the developers, and I expect that that is going to be much better over the next couple of weeks. If there's a problem getting through to My Turn, please call the county scheduling number at 707-472-2633 to get an appointment through the county. Other scheduling opportunities include using online waiting list, Vaccinate Mendocino, and also Schedule Genius. These are still preferred for the hospital and the clinic run events. NCO has also a scheduling service using the phone number 707-467-3239 or text 707-209-7161 and put NCO Vax in the body of the message. The vaccine supply is expected to be stable for the next 2 weeks. We're prioritizing second dose clinics at this time and hope to have some first dose clinics available. There are some this coming week, but they're not as big as we'd like to have them. We did receive some Johnson & Johnson or Janssen vaccine last week and are targeting them towards those people because of the logistical advantages of Johnson & Johnson. It is one shot, it is easier storage and handling and transportation. We're directing those to homeless, incarcerated, and hard to reach people, or to revaccinate some people for example, nursing homes where they don't have other access. So it's not restricted, but we're trying to use it intelligently because of its logistical advantages. Remember that the best vaccine is the one that you can get now or the soonest. Vaccine data, not including what the federal government gives to VA or retail pharmacies. As of today, March 19th, we have given over 42,746 doses in Mendocino County. That means that over 40% of Mendocino County adults have had one dose, and almost 19.6% have had a complete series. This compares to California, where 25% had had one dose. 55% of those in the lowest resource zip codes in Mendocino County have been vaccinated, and we're very happy that that is how we have dealt with our equity measures. We'll continue to focus on those communities as well. 42.5% of those people over 65 years old have been vaccinated, versus again in California, it is 22% have been vaccinated. In our county, 54.3% who are vaccinated are women. This week, we're beginning to open vaccine eligibility to construction workers in Mendocino County, because the fires we have suffered have made construction an essential activity for our recovery. We continue to reach out to all the previously eligible groups, but there's been some difficulty fulfilling schedules for vaccine events. And so if you want a vaccine, call for an appointment to be sure you're on those lists, and we want to get you in to give a vaccine. We have heard that some people have been turned away due to issues with documentation, and we want to emphasize we don't want to refuse anyone we have a place for. Also, verification of eligibility is now self-attestation, especially for those with medical conditions. But if you have trouble with proving where you work, come anyway. The vaccine clinics we have scheduled for next week for the county will be a second dose Pfizer on Monday and a second dose Moderna on Thursday. The other clinics have their events as follows. RCMS is trying to do a regular vaccine clinic on Saturdays, Laytonville on Fridays. MCHC, Mendocino Community Health Clinic, and Adventist Health Ukiah Valley work together regularly on Wednesdays at Alex Rohrabau Plaza. And Mendocino Coast Clinic will be having a vaccine event on Friday and another one next week. On April 1st, there is an event at Little River Stevie Star Center. And on the 2nd of April in Casper, there'll be a second dose Moderna clinic. County is also successfully piloting traveling vaccine teams, working with NCO and other community partners to support homebound and ag workers, as well as catching up with some nursing homes where vaccines may be needed for people who missed the national vaccine program through the pharmacies. Masks, again, it's recommended to double your cloth masks for better protection, or to put a cloth mask over a medical grade mask, but not for the N95 masks. So in summary, vaccines are here, but our cases and our hospitalizations have decreased. So we're now in the red. This means more activities will be opening, but we need also to avoid getting overconfident. So please continue wearing masks in public. Both the cloth masks, again, should be multi-layered or doubled. Keep your social distancing, hand hygiene, and keep as many activities as possible outside to increase ventilation. And remember to test often. This is how we protect our communities and our loved ones and prevent outbreaks. Variants are increasing in the state. We're seeing them all now in California, not in high numbers. And they do present a threat. Remember, Europe is going through another surge and having to restrict more activities. We do not want that to happen for us. So please remember the non-pharmacologic interventions, and finally get vaccinated as soon as you can. These vaccinations are safe and effective, even against the variants. That's our greatest hope for beating this terrible pandemic. And I'll end my presentation now and be open for questions.
Thank you, Dr. Coren, for that update. First, when we're about to open it up to the media for 2 questions each. And first up, we have Adrian Bowman. Adrian, whenever you are ready.
Hi everyone. Can you hear me?
Yes.
I was wondering, there's been some talk that vaccine supply might be going down. And so I'm wondering if you could speak to, beyond the next 2 weeks, what does the outlook look like for vaccine supply generally, and is there any sign that it's going to stabilize and become predictable?
Very important question. My understanding is actually the companies that are producing it, all 3 of them are, have been sort of stable this week, last week, and possibly next week, but that after that, we should be seeing a significant increase in the amount of vaccines that are available. And that is both federally and statewide. And the state health department is saying the same thing. So I have not heard that it'll be decreased.
Thank you. And then I think yesterday was the anniversary of the lockdown beginning.
Yes.
And sometime around then, we also had our first confirmed case. I think yesterday was the anniversary of our first confirmed case. I'm just wondering, sort of bigger picture. I usually ask you very narrow questions. What have you learned over the process? What has surprised you? Where did you think we were going to be a year hence, and where did we actually end up? Were there places where you think we did much better than you expected? Were there bullets that we dodged? Just if you could give us some kind of year in review for 1 year of pandemic now.
I think one of the things that I've learned to take home is that we are vulnerable. We are no longer invincible to infection, to pandemics. And we're also vulnerable to climate change and fires and misinformation. That was a big surprise for me this year, the amount of effect that misinformation and disinformation has affected our vaccine effort and many other efforts. So another thing I would say is the value of science. We need to stick with science. It may not be perfect, but it's better than guesswork. And the value of national and state leadership was very surprising to me, but without it, we saw, the horrible effects of this pandemic getting away from us. We need that leadership to mobilize the great potential of our people. And then the other thing I would say locally is that I've learned the value of partnership. Our local government, the hospitals, the clinics, emergency medical services, the schools, community organizations, our churches, schools, tribes, the Hispanic community groups. These are all necessary to fight this kind of a pandemic. And we're not over. We have to stick together at this point and in the future to grow our community. So those are some lessons that I've learned. And I do think it's a great opening to a larger conversation.
Thank you, Adrian, for those questions. Next up, we're going to go over to Danila Sands. Danila, whenever you're ready.
Hello, thank you for having this meeting. My question is in regards to schools. Now that schools have started to open in different phases, there are a lot of parents that are still sitting on the fence of having their kids go back to school. What kind of data can you provide that shows going back to school is safe, or maybe data in the past of any outbreaks, if any?
That's another good question. So there have been some outbreaks in other states. There have not been any large outbreaks or any outbreaks that I've heard of in California schools. Certainly no outbreaks in our schools. The people who are affected mostly are the staff, and that's who are the most vulnerable, and they transmit the infections the most. So in our county, we prioritize giving vaccines out to the school staff very early. And along with that immunity that's given by the vaccinations, the schools have also done a yeoman's job in preparing their schedules, their physical plants, the instructions and education they're giving to their staff and to the students to prevent infection. So I think that it's going to wind up being a very safe thing. They're bringing only some people back for hybrid education, and some people are still staying home and hanging back. But I think with the experience slowly starting, we'll be convinced that it's safe, and more people will be joining, and we'll have a very good school year.
Thank you. I really appreciate that. My other question is, in regards to testing at OptumServe, I believe you said that it had decreased some. I remember in the beginning we had to reach, and correct me if I'm wrong, like something around 130 a day in order to keep the site. Is that right? Yeah, okay, Becky's shaking her head there. So where are we today in regards to that?
We're definitely less than that at this point. No, I actually think we're averaging a little more. I'm going to ask Becky to speak to, you have the numbers probably, so why don't you answer that very specifically?
So if you want to move to another question and I'll come back with that answer, if you give me just a moment, Danila, thank you.
Okay.
Okay, so we will circle back to Danila's question. Up next, we have Susan Wolbarst. Susan, whenever you're ready.
Hi, I wanted to ask a question about testing people who've been vaccinated already. Yesterday, I heard Dr. Brewer from UCLA at Mike McGuire's town hall saying not to get tested if you've been vaccinated.
So that's a good question. I don't want to contradict, but we still advise getting testing on a regular basis. The vaccines are still young enough that we don't know how long they last. There are variants that are going around that may prove to be more resistant. And we do know that vaccines are not 100% effective. And so those 4 or 5% may be a larger number when we really get it out to the millions and millions of people in the country. We want to keep them all controlled. The vaccination does not affect the sensitivity of the tests. And so the tests remain a good way for us to detect asymptomatic infection and take the proper precautions.
Okay. So it sounds like there's room for disagreement on that topic.
Always.
The other question I had has to do with summer school. Has anyone heard anything about Mendocino County schools offering summer school to help children catch up for some of the number of year of school that they missed?
I have not. I would imagine that they would be able to do it under the same guidelines and precautions that they're using it for the regular school during the year. And so that's an open question. I don't have the answer to.
Thank you so much, Susan. Now we're going to circle back to Danila's question. Becky, if you want to take it from here.
Certainly. So we do have target numbers that we are working diligently to hit. We are currently trying to make sure that we're hitting 130 at least, preferably 165. Last week, our average at our OptumServe sites was about 87 people getting tested per day. That is the average across the events. So certainly we want to encourage people to participate in all of our testing events. It's a very, very important resource that we need to make sure that we maintain.
Okay, understood. Thank you so much, Becky, for that. Now we're going to move on to Alicia Bales. Alicia, whenever you're ready, you can unmute.
All right. Hi, can you hear me?
Yep.
All right. Thank you so much for this event. And I wanted to let viewers know that we will be rebroadcasting the audio of this on KZYX at 3 o'clock today. So if you missed any 91.5 in Willits and Ukiah or 90.7 in Philo. So Dr. Coren, it's nice to see you and talk with you. I wonder, we heard that you have administered, or at least Johnson & Johnson vaccine has been administered to inmates at the county jail, and that less than half of the inmates elected to take that vaccine. And this makes us wonder if we're going to get to a point in the county where the people who really want the vaccine are going to have it, and then we're going to have a substantial population of people who are vaccine hesitant. I'd like to know how you're planning to communicate with folks in our community, what your strategy is to encourage or at least inform those of the community who are vaccine hesitant to go ahead and take the vaccine.
Yeah, well, vaccine hesitancy is a problem for all vaccines, but certainly with a new vaccine, there's been a lot more reason for people to be hesitant. I think now that there are more and more people in the community that are getting the vaccine and have had it, we want to encourage all of them to speak to their friends and relatives and encourage them to get vaccinated. And as more people hear it from the people they trust, I think more people will sign on and get it. We have seen a significant hesitancy among healthcare workers. And as a consequence, we have seen some problems in healthcare institutions and outbreaks as a result of that. And we hope that there will be more people signing on and getting vaccines in that group. There are some rumors being spread and some fears that take shape in terms of things, for example, for women being concerned of infertility or men, or problems with fetal development. That has been so far not been an issue, and the obstetricians and pediatricians by and large are recommending it for pregnant women and nursing women because the research does not show a problem, and in fact new research has been generated that does show that it's safe. So the more we educate, the more we make the vaccines available, and the more people are out there saying, I got my vaccine and it wasn't so terrible, and encouraging their neighbors to get it. These Facebook shots of people getting their jabs are great. You know, it goes to all their friends. So we're going to have to do that. On a more detailed level, we do have a strike team. We're calling them a strike team that goes out to smaller group homes. We're backtracking among the healthcare institutions where there are people who've held out. We think they'll want it now. There are people who are restricted in home, and our strike teams will be going out. You mentioned the Johnson & Johnson vaccine, or Janssen as they're calling it. And that's an excellent use for people who are going to be hard to catch up with. We're reaching out to our lodging people on the coast and agricultural and restaurant owners further inland to try and get those groups of people into the clinics. And our advertising should be going out, and our, we've had a lot of requirements for verification. We're dropping an awful lot of that. When we got to the 16 to 64-year-old group that could get vaccines if they had chronic diseases of different kinds and or disabilities, and we initially said, well, bring verification from your doctor. We found out here in Ukiah and in Mendocino County, and they found out in other places in the state that was just an untenable situation. And so the state has also gone with self-attestation. And we're really trying to break down all the barriers that anyone has for getting a vaccine. And so those are some of the ways that we're addressing it. And any other ways that you may have, I'm open to hearing them.
Great. I will definitely be in touch with you about that. With 42,746 doses administered in the county, I'm sure that y'all are tired. You're doing amazing work. Thank you so much for that. And I wonder, looking forward, I know our listeners and commenters and everybody want to know what's next in terms of the tiers. Like now that we've had our taste of the red tier, can we look forward to the next tier? What is it and how do we get there?
So the next tier is the orange tier. And depending upon how quickly California can distribute vaccines to the lowest resource zip codes in our state, if we stay, before we get to an additional 2 million of those doses, we won't get into the red tier until our county case rate falls below 3.9 per day. That's a 7-day average with a 7-day lag. But once the state of California hits that 2 additional million that goes to the first tier of the Healthy Places Index, the lowest resource populations in our state, then that number that we have to achieve can be as low as 5.5, which we're at right now.
5.9.
And so we could be in that orange tier soon. I don't know how long it will take for us to get those extra 2 million distributed. I heard some very favorable reports today, I think it was, that surprised me, but I think we're gonna have to wait and see. It could be weeks, it could be a couple of months before we get there. But I think our county, if we watch our P's and Q's, I think we'll get there based on our numbers, and we may beat the state. So what that means, you asked 2 questions, and I'll answer that second one now. Let's see, we'll get to some of these. Retail is already open. Shopping centers, common areas will still be closed, but they'll be, there's not a maximum capacity. Places of worship will be open. They'll be at 50% capacity. Movie theaters will be up to 50% capacity. Hotels and lodging. The fitness centers will be up to 25% capacity, and they'll be able to appreciate indoor pools, and that will be the same for gyms and fitness centers that are freestanding. Restaurants capacity will increase to 50% or 200 people, and wineries, distilleries, and breweries that serve food would be the same as restaurants. They will be open indoors, though, with a 25% capacity or 100 people, whichever is fewer. And the restrictions about 90-minute time limits and some of the other restrictions are taken away. And bars will be able to open outdoors, even if they are not serving food. And there will be more advice coming after April 1st. So I don't want to jump the gun on that. And I don't think we need to go into that. But those are some of the main ways that we'll be liberating ourselves from this shutdown, as long as we don't get into another surge.
Thank you so much for those questions, Alicia. Next up, we have one pre-submitted question from Matt Lefevre with KMUD. That question reads, what is the county expecting to see when it comes to the CDC's recent guidance that 3 feet is now an acceptable distance in a school setting? Will California Department of Public Health reflect that change, and will the county reflect that change?
So let me just respond by reminding anyone who's listening that CDC is a wonderful organization, has fantastic scientific information, but they don't have jurisdiction in California. And it's not just jurisdiction. We rely on probably one of the best, if not the best, Department of Health in the country that's run by a state. And having it go through the state, which does have jurisdiction, it makes us more safe, and they can apply it to the needs of Californians better. So I expect that they will address that, and there are many other things that CDC has recently published, but we need to wait for CDPH to do that, and then Mendocino County will most likely follow suit. We can't be more or less restrictive than the state. We could be more restrictive than the state, but we wait for the state guidance.
Okay, thank you so much for that, Dr. Coren. We do have a couple of questions from the public that we would love to see if we can have answers for. One question is when, and I'm going to paraphrase this, when is the age going to drop to get the shot? So I'm assuming that that means some vaccines are okay for age 16 and above, some are 18 and above. Do we have an approximation of when we might see that age lower?
So again, as you said, for people who are over 16 years old, the Pfizer vaccine is available and felt to be safe for them. Other manufacturers and the ones who are already producing the Pfizer, Moderna, and Janssen are including in their trials a younger group of people. And that has to be done carefully, and it'll probably be done by various different age groups. But so far, none of the vaccines have been approved for use in people under 16. And remember, it is an emergency use authorization, so it's an experiment. These are experimental drugs, and we want to just ease into them when we're very sure. We've really collapsed the time from development to research to then administration tremendously because of the worldwide effort to do this testing. But we need to give it time to make sure that it's safe for our young people.
Thank you, Dr. Coren, for that. We have another public question. Why is Mendocino County ahead of the curve in vaccinations in comparison with the state?
Well, I can't answer that 100%, but I think it's because we work with our partners so closely, and we've taken feedback from them about what areas we need to move more heavily on and where we should fall back. We did develop early on in the course of this a ethics advisory committee because there are going to be differences from the feds to a different state, from the state to different communities. And the ethics committee allows us to parse some concerns within our county and say, oh, we should move a little bit quicker on this group. We want to keep in mind the equitable framework that the state has laid out. But for example, in our county, we moved up, for example, water and wastewater management. When we had a outbreak in the courts and the juvenile hall system, we increased that group of people to get vaccinated. We've just been ahead of the curve in terms of moving through the tiers, and it's because we work with our partners so closely. They know their communities, they go through their patient lists, they call people in, people know them, and so there's a lot of trust that's going on. And I think it will continue like that. I think we're ahead because we work together.
And one last question from the public. Is it possible to move back a tier, and what would need to happen for that to occur?
Not something I like to think about, but yes. So if we are not continuing within the red tier metrics, and they would give us 1 to 2 weeks, then we would be moved back. We would have to go back to closing certain enterprises that are open. But again, it's not something I want to think about, but we do think about it, and we'll be ready for that if it should happen. Right now, we want to give out vaccines, protect everybody, making sure everybody is protecting themselves, and keep going forward to open our community.
Thank you, Dr. Coren. And with that, that is all the time that we have. I would like to open it up to you one more time, Dr. Coren, if you have any closing words.
Well, I will say it over and over again. Stay well. Make sure you're using your masks, keeping social distances, and as much as we can have outside activities because the ventilation is better. Make sure that you are getting vaccinated as quickly as can. There is some hesitancy or preference for one vaccine or another. That is just anecdotal. The fact is that these vaccines are safe and they're effective, and the best vaccine is the one that's right in front of you. Go get it.
Thank you for that, Dr. Coren, again. So that sums up today's COVID-19 update. Our next update is scheduled in 2 weeks on April 2nd. In the meantime, please continue to follow Mendocino County Public Health on Facebook for all COVID-19 updates.
Thank you.